move on to the next, before the break, of course, we now move on to the next critical discussion focused on India-specific solutions and the possibility of expanding clinical trial opportunities for Huntington's disease within the country. It's my privilege to invite Dr. Manpreet Kaur, Director, Health Parliament, um, to kindly share her insights. Dr. Kaur contributes to healthcare policy research, digital health initiatives, stakeholder management across the health ecosystem. Her work focuses on public health innovation, healthcare policy, leadership development, digital health transformation. Dr. Kaur, the podium all yours. Should need a mic, a hand mic.
So thank you so much for inviting me today. I am here on behalf of International Patients Union and Health Parliament. So it's not coming. Hello, can you hear me? Yeah. So hi, I am here on the behalf of International Patients Union and Health Parliament. These are the two platforms we are building. And I'll speak on the need of having such platforms where we can bring the voice of patients at the center stage. And the platforms which are consistent and updated and bring in the technology solutions. So International Patients Union is a patient platform and Health Parliament is an advocacy group. So I will give you a brief presentation about work and how we can work with the HT Society India hand in hand, bringing voice of HT patients to the forefront. So yeah. So in India, specifically, when we talk about patients, we have healthcare system in general. We see that doctors are organized, so they have their associations and the communities, and they are able to bring their voice at the forefront through policy, changes and new policies. And also, the pharmaceutical industry is very well organized and they have a strong lobbying group and advocacy group. And they are able to actually get things done. But when it comes to patients, we do not see much of progress. And, healthcare system in general, when we talk about in general, textbooks or around the round tables or at the international platforms, we say that patients are at the center stage, at the center of healthcare system. So whatever we do as doctors, policymakers, industry stakeholders, we try to argue that our solutions actually bring a change in the patient's life, but it rarely do so because, we are talking about here benefits, the profits, but not about the welfare of patients. So that's why we started with this initiative, International Patients Union, so that we can organize the patient groups together. Yeah. So moving on to next. So it was founded by Dr. Rajendra Pratap Gupta. He's a very well-known policymaker. He has written National Health Policy 2017, and he was a key part in the National Education Policy Committee as well. And he drafted the manifesto for the current government. He has actually got involved in a lot of policies of the current government, whether it is on the labor welfare side or economic side. And he chairs the various international committees, be it the United Nations Internet Governance Forum on Environment, Digital Health, or Digital Economy. And he also chairs the Commonwealth AI Consortium. So actually, he's supposed to be here, but he has to travel to Nepal, and he sends his best wishes to the group. So International Patients Union started in 2014. Dr. Rajendra at that time ideated and felt the need to have this union in place. And then after that, he got involved as an advisor to the union minister, JP Nadda. So he didn't get the chance to actually initiate the platform. So when he got after his leaving the office of advisor, he again started mobilizing the resources and stakeholder for this voice group. So in 2022, he actually put a team to start this platform again. And 2023, we officially launched the International Patients Union app through a conference, which we do every year at Delhi at the India International Center. So first conference was held at 2023. The intention behind having such conferences is to actually, invite patients at the stage so that they can speak about their conditions, what challenges they are facing, be it with the healthcare system in general or managing their conditions. And in the audience, we put policymakers and stakeholders so that they can listen to these patients and bring in such solutions which can increase the welfare of the patients. So continuing this tradition, we have organized this conference every year in 2024, in 2025, and in 2026 as well. So our first session always start with the patient. So we always have a panel group of patients, be like, those who are suffering from diabetes or, HIV patients living with, suffering from tuberculosis, recurrent tuberculosis, or someone who is caretaking a disabled patient. So what kind of challenges they are facing as a caretaker. So we also should bring the voice of a caretaker into the healthcare system. So this is our idea about one of the initiative at International Patients Union through these conferences. And this is about the glimpse of these conferences. The first conference where the theme was Patients, the Missing Voice. And we had Dr. Prem Namgyal, Director Program Management, WHO CRO region. I'm so sorry. Just a second. Can you move this to the previous slide? It's moving automatically here. I'm so sorry. So never mind. So in our one of the initiative Global Digital Health Summit, which also do every year, it's a big conference on digital health, and we invite stakeholders from all across the world every year. So in this digital health conference, we also try to bring in the patient's voices. So our first session always starts with the patient, and in 2023, 2024, 2025, and in this year as well, 2026, we will start the session bringing in the patient voices to this big mega stage, so that not just the stakeholders from India but across the world can hear the stories of the patients and bring in the and hear their stories and bring in the solutions and maybe try to build the solutions when they go back home. So this is a glimpse of the Global Digital Health Summit. So in GDHS 2023, September 1 to 2, Mumbai, we had session Patients as Partners in Digital Health, Expectations of Patients. In GDHS 2024, which was again held in Mumbai, we had first session as Digital Health, Patients' Expectations versus Reality. And in GDHS 2025, we again held first session, Patients' Perspective in Digital Health. So, we invite, the big MNCs as well, and, the Google, be it Mayo Clinic. So we had Chief Health Officer, Karen DeSalvo, Dr. Karen DeSalvo in audience in Mumbai during GDHS 2023. And she keenly listened to the first session. And after the session, she actually came to us and personally commented that, she has taken a lot of notes by hearing the patient stories. And she will go back and sit with the Google team and try to build certain solutions which will actually improve their lives. In continuation of that, I was talking about the technology, and there was a speaker mentioning that the progress in the last decade was very quite slow when it comes to developing solutions and all the platforms. But bringing in the technology, the AI development, we have the hope that we will be actually able to address the challenges these patients face. So we have developed an IPU app. This is a platform freely available to all the patients and the caretakers. It is available in the 15 plus Indian languages. So, the patient sitting in any corner of India can access this app in their own language. And we have disease specific associations as well, the communities, which is now limited to 32, but we would like to collaborate with HD Society India if we can have a specific disease specific association for HD patients. And of course, it's free for all patients. By joining this platform, you can access the resources developed by various multilateral bodies and the government of India, and the government schemes offered by the central and state governments. And also, you can put your experiences not just in the text format by typing it down, but you can also, it's a voice enabled. You can just put your question, can speak to the app, and it will take your question and put in the app. And also, it's a multilingual, of course. We have tie-up with the Bhashini, Government of India Services. That's why we are able to provide these services in 15 Indian languages. So more than 30 health communities and associations have joined, and you can participate in polls and also facilitate communication with fellow patients. Suppose I am a patient, I have certain experience living with a disease. I can go on this platform and share my experience so that my fellow patients can learn from this and gain certain like maybe a solution from my experience as someone living with a disease condition. And also as a caretaker, I can speak with the fellow caretakers how they are handling the situation at home, be it with the patient, be with the the patient, or within the fellow family members, and also with the doctors. And also as a one of the feature, you can post anonymously. You do not have to post your name and say that, okay, I am Dr. Manpreet, I am suffering from certain disease. You can post anonymously and share your experience here. And also on the advocacy side, from International Patients Union, we have put a lot of policy submission to the government of India, be it on the health of manual workers, or redefining health in the age of digital health, or which are we also spoken about clearly about patients should not be the training ground for the training doctors. So patients should have the right to ask for whether he should be whether I should, or as a patient should be treated by an intern or a training doctor or experienced doctor. So we have also spoken categorically about the patient's right, and also how we can make the hospitals more patient friendly and reorienting the AMR approach. International Patients Union was also invited by WHO in recent past by the office of Dr. Tedros, and we have signed with an MOU with the International Pharmacopoeia Commission and the Bhashini Services. We are already a collaboration, and in progress is the integration of eSanjeevani. So I would like to actually open this platform for all the stakeholders present in the room, how we can collaborate on various issues, be it HD, be it any other rare disease, because this platform was created with one mission only, to bring the patients' voices to the forefront. And if time allows, I would also like to speak about the designing problem of our current health system. So, here when the speakers were talking about the challenges faced by HD patients, we have spoken about a lot of points, from many years, we are consistently facing the same issues and we are not able to actually resolve. So by putting a lot of money, efforts as well, we are not able to create something substantial. It's time, I believe, that we relook at the lens. We take this lens and relook at the health system and see how we can actually revamp the design of the current health system, be it when we speak about inclusivity, accessibility, affordability. My mission goal leading the Health Parliament International Patient Union is to actually, is that, in the coming time, maybe in this decade only, we should not be speaking about the same challenges again and again. So, for example, I'll give you an example, tuberculosis. Tuberculosis is an ancient disease. It was mentioned in the, in the old grunts and the textbooks, and, and also in the classic novels as well. We have spoken about tuberculosis. But even with today's resources, funding, and the advancement, we are not able to eradicate the tuberculosis. So it tells a lot about the issues in our current healthcare system. So if time allows, I would love to speak on the designing problem. So this is the Health Parliament. It's an advocacy group that we are leading, and it's a global advocacy group. And we have done a lot of good work and bringing in solutions and changes in the how we talk about the health. And our mission is to put real work and build great leaders and write policies. And we have engagements with the WHO, United Nations, World Health, ISFTH, Commonwealth, government blockchain associations. It's a community, and anyone can join. If someone who is a healthcare professional is interested in the advocacy work, they can join the Health Parliament. So we have few of the campaigns which are working, which we have created for the betterment of the society. Few of these is the feel something, do something. So if you feel like, you are feeling something as a, like, I am sitting at home and I feel a symptom, and maybe it's a recurrent symptom, I should not ignore. I should go, like, get up and, go see myself to the doctor, rather than, because generally what happens in the family, even my own family, what I see that, when my father and mother feels like, they are feeling something, they are not feeling well, they generally tend to ignore that. Okay, koi baat nahi, ye to hota rehta hai, we will see, maybe later, dobara dekhte hain, dobara hota hai, and then they say, okay, I don't think so, kuch hai, ye to hota rehta hai. I think it's time that we should, like, drop this attitude, and whenever, like, we feel a symptom, a sign, we get up and do something about it. And also we have a campaign on Neither Share Nor Learn, which is about, stopping the spread of misinformation. So generally what happens when we are on WhatsApp, we get a lot of information, and if we feel that, this is a misinformation, we should stop ourselves, and we should stop right there, and should not forward this information to any other person on the WhatsApp. So it's neither share nor learn from it. And Just on You is also a very creative campaign that we have drafted. So in this is a Just on You campaign. We believe that youth has power to bring in the change, and in the family as well. There are children and the teenagers, and parents generally unki zyada sunte hain when a kid comes to grandfather, grandmother and say ki okay, आप डॉक्टर को दिखाइए, आप ठीक नहीं लग रहे हैं, they tend to listen to them because they have this force. So through the Just on You campaign, we want to create a joy in the family. We want to train them. They should recognize a symptom in the family. They should be able to provide basic first aid in the family. Suppose, someone is, is a diabetic patient. As a student or maybe a teenager, I should know how to measure the blood glucose through glucometer. I should know how to measure the blood pressure by using the devices. I should know how to actually recognize a symptom which requires first aid or urgent need of medical treatment. So this is one of our initiative, a public health campaign that we have created. This is a few of our groundbreaking policy reports on various issues, be it on the Parkinson's disease and Alzheimer's disease, and understanding the digital health in current era. And we have also worked with a lot of multilateral organizations. We have worked with the ICMR. We have worked with the Global Call to Action Against Poverty, and also we have organized one nationwide survey on understanding the hearing and speech disorder. So this is our healthcare guidelines development group. So we have developed guidelines on the women's health guideline. So as a woman, we tend to ignore our health, and generally from the doctor's perspective, what happens is that they tend to start thinking about a woman's health when there is they enter into the age of when they start their period, and their understanding of health drops when the woman reaches the age of menopause. So by developing this guideline, we want to bring in the 360-degree perspective on women's health. And this is one of our global initiative, Digital Health Sans Borders and Geneva Declaration of Responsibility, which was launched on the sidelines of World Health Assembly last year. So I was talking about technology, and there are a lot of engineers and organizations working and developing solutions which can actually help a lot of disease, and in maybe actually providing cure and treatment to the disease. But what happens, there's technology technologies are behind the wall and they are not openly shared. So this is our bit to actually push these organizations to make this technology open source, so that every society, be it small or big, can benefit from the developments and the latest technology. So we had the leaders which represented the half of the global workforce in the room, and they signed this declaration of responsibility that they will actually work towards making this technology open sourced. And we had Dr. Tedros, message for this side event as well. His push to make digital health as an open source tool. And of course, this we also have a mobile app for this. If you believe that you want to work in advocacy realm and would like to push your cause in front of the government, you can join this platform. And I look forward to hearing from you and take this discussion forward. And of course, together we can make the patients heard. Thank you so much.